Hello, my name is Teresa Gilkey, and I am an RN and BSN student at Aspen University. And this is for the model. Model, do you give permission, verbal permission, to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University Class N495?
Yes.
And this assessment is intended to show my skills with the assessment actions only, as not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Will you please state your name and your first and last name and spell your last name?
Kayla Howard, Howard.
And can you please tell me your date of birth?
December 5th, 1998.
Okay, thank you. I'm going to start the assessment by washing my hands thoroughly. Okay, I've washed and dried my hands, and now I'm going to start the assessment by taking vital signs. And this is a comprehensive physical assessment. I'm going to start out by taking your temporal temperature. Your temperature is 97.9. Let's put this on. Let's check your oxygen level. And that'll give us your pulse as well. Do you have a specific arm you want me to check your blood pressure in?
All right.
Okay. I'm going to be checking your blood pressure by using the two-step method. First, we're going to find your brachial artery. Okay, feel it. Put this at least 0.5 centimeters above your brachial artery. And the two-step methods dictate that I first check your radial pulse, and I'm going to press this up until I no longer feel pump it up until I no longer feel the radial pulse. Okay, looks like it's at 100. I no longer feel it. Okay. And I'm going to work 30 seconds. And then after 30 seconds, I will listen for her blood pressure. And that means I'm going to, because I heard it, I'll stop hearing her radial pulse at 100. I'm going to pump it up to 130. Blood pressure of 110/60. Thank you. That's the blood pressure. The next thing I'm going to do is I'm going to put on gloves. I'm going to assess your head. I would ask you to remove the ribbon from your hair so that I can really get a good feel of your scalp. On a scale of 0 to 10, with 10 being the worst, do you have any pain?
No. 0.
Okay, 0. Okay, thank you. Okay, easel. Okay, and I'm looking for any sore spots, any lesions, any signs of alopecia, looking for any infestations. Okay, I don't see any. Okay. Remove these gloves and discard them. Since I remove the glove, I'm going to take the sanitizer and clean my hands. And I'm looking at your face and I see that it looks symmetrical. And I'm going to start by checking your temporal area, checking your temporal pulses. And palpate that for any pain there at all.
No.
Okay, thank you. And now I'm going to check your carotid. Anything there?
No.
Now I want to assess your T&J. If you would, can you open your mouth, please? Okay, I don't feel any clicks. Hear any clicks? Any pain or discomfort?
No.
Okay. Now I'm going to get behind you and assess your thyroid. Okay, can you lean forward a little bit for me? Any pain or discomfort?
No.
Okay. I don't feel any lumps or any swelling. Okay. Can you swallow for me? Okay. I'm going to take your trachea. It appears to be patent in line. And now I'm going to assess cranial nerve 5. And what I want you to do is clench your jaw. Okay. You clench your jaw. I'm going to feel at your J level, and also want to feel clench your jaw. Okay. Any lumps, anything unusual? Okay. Now, I'd like for you to raise your eyebrows for me. Okay, frown for me. Smile. And close your eyes really tight. Okay, that's assessing your facial symmetry. Okay, I want to assess your hypoglossal at cranial nerve 12. Can you say light,
Light.
tight,
Tight.
and dynamite?
Dynamite.
Okay, thank you. Now I'm going to palpate your cervical lymphatics. In other words, palpating your lymph nodes. Okay. You start here, behind your ear. Cool. Okay. Submental. Supraventricular. Okay. Any pain or
No.
area? Wonderful. Okay, now I want to look at your skin. Let's see, it's warm and dry. You have good skin turgor. Okay, that's your fingernail. Okay. Wrist capillary feels. Do you have any problems with swelling anywhere?
No.
Anywhere? Can you cross your legs for me? Okay. All right. Okay, no signs of swelling. Okay. I'm going to clean my hands again. Some gloves. I'm going to look at your eyes. Can you look up for me? Okay. Look to the right, the left. Okay. Sclera appears white. No signs of jaundice. Okay. No redness in the conjunctival area. Okay. Now I'm going to line over here, and I want you to do the six fields of cardinal, and I want you to follow this pen with your eyes and without moving your head. Okay. Thank you. Now I'm going to do what we call confrontation. I want you to cover your right eye. Okay. And then I want you to let me know how many fingers I'm holding up.
2.
Okay.
1.
Okay. Other eye. Okay.
1. 2.
Okay. Wonderful. Okay. And I want you to Look straight at my nose and follow the pen. Now I'm going to assess your ears. Any pain?
No.
Okay, your tragus is movable. I'm going to get my otoscope and I'm going to look inside your ears now. I don't see any signs of drainage, any problem with drainage coming from your ears. Okay, I'm going to pull your ear upward toward me so I can put the otoscope in. And I don't see anything unusual. Your drums are gray, pearl white. Probably be if there was redness or pain. I'm going to check your eyes for I'm going to turn the lights off and I'm going to check your pupils to see if they're equal and reactive. Okay. Sit straight. Okay, and your pupils are equal and reactive. I'm going to get the tongue blade and I'm going to, if you would open your mouth for me, please. Say ah. Touch your tongue. Okay. Any problems with pain or bleeding or any problems in your mouth?
No.
Thank you. Mm. I'm going to assess your sinus area. Let's try a little bit. Any pain in this area?
No.
Okay. What about here?
No.
Okay. This is again, I want to look in your nose. Any problem with drainage or congestion or anything?
No.
And the next thing I'm going to do, I'm going to clean my stethoscope. Okay. Trash. And what I'm going to do now is take a deep breath for me. A little bit for me. Just a moment. You turn your legs this way. Essential ones for tenderness and also for evenness of your respirations. Okay. You take a deep breath. Good. Okay. Wonderful. And now I want you to say, as I do this, I want you to say the words 99, and you'll feel me going up with my hands. Okay. More now. Okay.
99.
Mm-hmm.
99.
Mm-hmm.
99. 99.
All right. Wonderful. Now I'm going to percuss for resonance. Okay. Just hitting you. Okay. Any tenderness?
No.
Okay. And now I'm going to check for CBA tenderness, and what that does was tell me could be a sign of kidney infection if you feel any pain. And you're going to feel me pounding on your last rib, and I'm going to pound on that, and you're going to see below it, and you're going to, which is where your kidneys are. Any pain?
No.
Okay, thank you. I'm going to listen to the front of your chest. So you take a deep breath for me. Okay, good. Okay. I'm going to listen to your carotids for Bruit's and Thrill. A sign of if you have any Bruit's could indicate that you have an occlusion, a blockage. Okay. Noted. Next thing I'm going to do is listen to your heart. Thank you. These are aortic. Pulmonic. One in S2. Mitral. This would be I'm sorry, tricuspid, and this is mitral. Thank you. Mr. Regular. Okay, and I'm going to start off by looking and inspecting your abdomen. Any bulges or pulsations, any signs of that. Then I'm going to listen to your right lower quadrant. I listen for at least 5 minutes. The vowel sounds. Now I'm going to palpate. Any pain or discomfort, let me know. Good. I'm going to let's look at your extremities for me. I'm going to look at your wrist. Any pain or discomfort with your wrist?
No.
Can you press down on my hand? Okay, hold your hand. Press down. Okay. Can you shrug your shoulders? Any pain or discomfort in your shoulders?
No.
Is that even? Okay. And now let's check up your knees. Can you bend your knees okay? Push down on my hand. Push down on this hand. Okay. Any pain or discomfort here?
No.
Okay. Wonderful. Play my hands again. Okay, I'm going to assess your posterior, your pulse, dorsalis pedis. Okay, appear to be equal with your radial pulses. Okay, go as well. Okay, if you would, please set up for me. Okay, you just slide down right there. Check your elbow. Any problems with that?
No.
Okay. If you would stand up for me, please. Okay, and would you stand there for 30 seconds with your eyes closed? Okay, good. Wonderful. Now, I want you to walk heel to toe. You're right here and then come back. Heel to toe. There we go. Okay, wonderful. Okay, you can sit down for me. Now I want you to, if you would, take your hands and slap your thigh with your hand back and forth as fast as you can. Okay. Yeah. Okay, now I want you to take your feet and pat your feet as fast as you can. One foot and the right one. Okay, and you're doing both at the same time? Wonderful. Thank you. Now, let's see. I want to, let's check your reflexes for me. Okay, got the hammer. I'm going to hit your knee. Okay, thank you. And let me see elbow. All right, wonderful. That concludes my assessment. I want to thank you, Model, for helping me with this assessment. Have a nice day.